So today we're going to dive into a framework that is, well, it's absolutely essential for anyone in a caregiving role, whether that's your job or just your life. It's called DABDA. And trust me, it's a powerful toolkit for showing up with compassion when things get tough.
Why me? Wow, that question, it's just packed with so much pain and fear and confusion. If you've ever been in a high-stress medical setting, you've probably heard it. And that one little question, it just throws a spotlight on a huge communication challenge. How do we possibly respond to that level of emotion with real empathy and clarity?
And that's really the heart of it, isn't it? World-class care isn't just about fixing the physical stuff. It's about understanding the deep, profound emotional journey a person is on. Getting a handle on that is, for sure, the first step to providing support that's truly centered on the patient.
So, to help us find our way on this journey, we actually have a map. It was first developed by psychiatrist Elizabeth Kubler-Ross from her work with terminally ill patients, and that map is DABDA. It lays out 5 really common emotional stages that people often go through in a crisis. Think of it as our guide to understanding what's really going on under the surface. Okay, so let's break this guide down. We're going to walk through each of these 5 stages, and we'll look at what they actually look like in the real world and, this is the most important part, how we can respond in a way that genuinely helps. Now, while we often see the stages laid out in this nice, neat order, it is so important to remember that everyone's journey is totally unique. People might skip stages, they might go back and forth, or experience them in a completely different order. And even though this model came from studying grief, its ideas are invaluable for understanding how we respond to any major life crisis. So this isn't some rigid checklist, it's a flexible framework for empathy.
First up, we have denial. You can think of this as a protective layer, really. It's the mind's way of hitting the brakes, of absorbing a shocking new reality at its own pace. Our job here isn't to shatter that defense. Instead, it's to be a calm, patient presence, gently offering bits of reality without ever forcing a confrontation. Next up, anger. And what's so interesting here is how it reframes what anger really is. So often, it's just a mask for something deeper, usually a profound sense of fear and helplessness. The most powerful thing you can do is not to react, but to listen. Validate their frustration. Something as simple as, I can see how incredibly painful this is for you, can make all the difference.
And then we often see bargaining. This is all about the search for some control in a situation that feels completely out of control. And for us, it's a really delicate balance. We have to respect their hope, but we also have to stay grounded in reality, providing clear, honest information without making promises we can't keep.
When someone hits the stage of depression, they can feel so deeply isolated, so hopeless. Our first instinct might be to try and fix it, right? To cheer them up. But that can actually make them feel dismissed. Honestly, the most powerful response is just to be there. Our role is to listen without judgment and to communicate with our actions that they are not alone in this.
And finally, we have acceptance. Now, this doesn't mean happiness. It's a calm acknowledgement of what's real. It's a moment of incredible courage, really. And at this point, our role kind of shifts. It becomes about fully supporting their decisions and giving them clear, practical guidance for whatever comes next. So we've seen how this framework can change a one-on-one interaction. But its impact? Oh, it's so much bigger than that. Using DABDA creates this ripple effect that can transform not just a single conversation, but the entire care environment.
And this slide just lays it out perfectly. When we learn to respond instead of just reacting, like when a doctor sees anger not as a personal attack, but as a stage of grief, suddenly conflicts go down. This means fewer misunderstandings, which leads to higher patient satisfaction. And just as important, it actually lowers stress on the staff, creating a healthier, more empathetic environment for everyone. It's a win-win.
But this isn't just some clinical tool for hospitals. This is a life skill. I mean, we all know someone going through a tough time, a loss, a major stressor, a personal crisis. By just having this framework in the back of our minds, we can offer more grounded, more effective support to our friends and our family. So this all brings us to a call to action. How do we actually take this framework and put it into practice every day? Well, it really comes down to making a conscious choice in every single interaction we have.
It starts with just observing. Before you jump in to speak, just take a half second to pause and ask yourself, based on what they're saying, what they're doing, where might this person be on their emotional journey right now?
Next, you turn that focus inward. Is my response actually tailored to their needs right now?
Am I trying to use logic with someone who's in deep denial, or am I getting defensive with someone who's lashing out from a place of fear? That self-awareness is absolutely key.
And the final check is all about impact. At the end of the day, what is my communication actually doing? Our goal is for every single person we interact with to feel seen, to feel heard, and to feel supported. Our words should be building bridges, not walls.
And that's what this all boils down to. This framework isn't a script you have to memorize. It's a tool to help us connect with each other, human to human, on a much deeper level. Because at the end of the day, a technical procedure might fix a body, but it's that human connection that truly begins to heal.